Hi, Mrs. S. This is Jenny Katia. I'm going to do my optic nerve test on my husband, Cato. Okay, I would knock on the door, introduce myself, come in, tell him who I am, wash my hands, ask him his name, date of birth, match the medical records, making sure everything is okay, explain the procedure to him, ask him has he ever had it done or does he want information on it, explain to him we're not doing anything invasive. So then I would start off, after I wash my hands, do you mind, I would ask him is he allergic to anything, any medications, any latex, any food. That's nothing. Ask him is it okay if I put on gloves, and then I would start with pulling my curtain, make sure we give privacy. And I would start with the cranial nerve number 1, olfactory. So I would tell him to close your eyes and plug up one side of your nose. I'm going to put something under your nose and you tell me what you smell.
Alcohol.
Okay, plug up the other side. Sorry, I'm reaching across. I got my supplies over here.
Coffee.
Okay, oops, I spilled it everywhere. Very good. So cranial nerve number 1, olfactory, is intact. Cranial nerve number 2 is the optic. And I got a little makeshift Snellen chart. I'm going to ask you to cover one eye, hold this out arm's length, and tell me the furthest line you can read down. Arm's length.
I can read line number 8, ACDZQR.
All right. Do the other side. Cover the other eye. And hold it out arm's length.
I can read line number 8, ACDZQR.
Okay. Now look at both eyes and hold it at arm's length.
I can read number 8, ACDZQR.
Very good. So he has 20/20 vision. Okay, I'm going to stand in front of you. I need you to cover your right eye, and I'm going to cover the same eye on the same side. I'm going to bring in my fingers and put up numbers, and you tell me how many numbers you see.
2, 3, 4.
All right, other side.
2, 3, 4.
Very good. So his peripheral vision is intact also. So that's cranial nerve number 2, the optic nerve. So I'm going to do cranial nerve number 3, which is the ocular motor nerve. So I'm going to look at his eyes, make sure the pupils are the same size on both sides, and then I would measure it. I don't have my pen light, so I'm going to say 4 millimeters. I'm just going to make sure everything is symmetrical. Both the eyes, one is not larger than the other, no redness, nothing going on with that. I would dim the lights and look straight at me, and I bring my pen light in on each side and making sure his pupils dilate. So that would say they were reactive to the light. I mean, not dilate, but shrink to react to the light. So their pupils are equal, round, and reactive to the light. Equal, round, and reactive to the light. They're the same size. So ocular motor cranial nerve number 3 is intact. Now I'm going to do number 4, which is the trochlear nerve. Cranial nerve number 4, trochlear. So I'm going to have you look at my pen light, and I'm going to bring it in, and his eyes cross. So that means it is intact. So the trochlear is intact. So I'm going to skip over 5, trigeminal, and I'm going to go to 6, which is abducens. Now with abducens, I'm going to take my pen light, and I ask you to follow my pen light, or my finger is going to be here. And I'm going to make an H, and his eyes followed it. One didn't move opposite the other. There was no jerking or twitching going on. So that would mean that cranial nerve number 6 is intact, abducens. So I would go back to the trigeminal. Cranial nerve number 5, the trigeminal. I'm going to ask you to act like you're chewing. Do it again. Again. Okay. So I can feel the muscles and make sure they're equal on both sides and they are moving like he's chewing. I can feel it on both sides. I'm going to take my Q-tip. I'm going to ask you to close your eyes and tell me where I'm touching you.
My left forehead, my right cheek, my left cheek, my right forehead.
So he felt everywhere that I touched him at. Excuse me. So number 5, the trigeminal, is intact. So I'm going to go to number 7, the facial cranial nerve number 7, the facial nerve. I'm going to ask you to smile for me, frown, blow out your cheeks, raise your eyebrows. And everything's moving symmetrically. There's nothing one side going higher than the other or anything in that sort. So cranial nerve number 7, the facial nerve is intact. So I'm going to go to cranial nerve number 8, acoustic. I'm going to go behind you. I need you to close your eyes and tell me when you hear something or which side you hear it on.
Right side, left side, left side, right side.
So cranial nerve number 8, the acoustic is intact. So while I'm back here, I'm going to go ahead and do 11, which is spinal accessory. I need you to push up with your shoulders. And he's got resistance on both sides, and they're equal. I'm going to ask you to push your head to your right. And that has resistance, other side, and resistance. So number 11, spinal accessory is intact. I'm going to come back around to your front. And I'm going to do spinal nerve number 9, glossopharyngeal. Excuse me. With glossopharyngeal, I'm going to ask him to cough, like I just did. I need you to swallow. Swallow fine. Everything look good. I'm going to say, open your mouth, stick out a tongue, and I'll have my tongue depressor, and I would test his gag reflux, which I'm not doing that, and it's intact. Let's say that. Number 9, glossopharyngeal is intact. Then I'm going to go to 10, which is the vagus. I'm going to ask you to open your mouth. I'm going to look at the uvula. It's intact and it's midline. I'm going to say, I need you to say ah. He says ah, it's going up and down, no problem. So cranial nerve number 10, the vagus nerve is intact. I'm going to go to, because we did 11 already, to number 12, the hypoglossal is cranial nerve number 12. So with this one, I'm going to have you stick out your tongue, and I'm just going to look at the tongue, make sure it's midline. I'm going to ask you to move it right and left, up and down, and no problems with it. So cranial nerve number 12, hypoglossal is intact. That's it.